Hey there, cat lovers. Have you ever found yourself cleaning up after your cat more often than usual, worried about what might be wrong? Let's face it, nobody likes dealing with cat poop, especially when it's not, well, normal. Diarrhea is no joke, and it can be a real pain in the litter box, both literally and figuratively. But beyond the inconvenience, diarrhea is your cat's way of telling you something's off in their body. They rely on us to decode those signals and get them the help they need. In today's video, we'll walk you through 5 common causes of cat diarrhea and give you effective treatments to help your furry friend get back to normal. We'll empower you with the knowledge to be your cat's advocate and get them feeling like their frisky selves again. Stick with us until the end to learn tips that could save you a vet visit. Let's dive right into it. One of the most frequent flyers in the world of cat diarrhea is something we can all relate to: food. Think about it. You eat a dodgy burrito from that questionable food truck, and bam, you're glued to the toilet. Cats are no different. Their digestive systems are finely tuned instruments, and sudden changes can throw them out of whack. Imagine you've been eating the same breakfast cereal every day for years, and suddenly someone switches it up with a completely different brand or flavor. Your stomach might grumble and protest, right? Well, that's exactly how your cat feels when you introduce a new food too quickly. Their bodies need time to adjust. And just like some folks can't handle lactose or gluten, cats can have food sensitivities or allergies too. Dairy, grains, and even certain protein sources can trigger digestive upset in our sensitive felines. If you suspect your cat might have a food sensitivity, it's like playing detective. Start by thinking about any recent changes in their diet. Have you switched brands, tried a new flavor, or maybe given them a little taste of your tuna sandwich? Even seemingly harmless treats can be the culprit. The solution? Slow and steady wins the race. When introducing a new food, do it gradually over 7 to 10 days. Think of it like a crossfade on a DJ turntable, seamlessly blending the old food with the new. This gives your cat's digestive system time to acclimate and reduces the chances of a poop-tastrophe. If the problem persists despite a gradual transition, it's time to consider a hypoallergenic diet. These specialized formulas contain limited ingredients and novel protein sources that your cat hasn't encountered before, reducing the chances of an adverse reaction. Remember, every cat is an individual, and what works for one might not work for another. Now let's talk about those pesky little critters that can wreak havoc on your cat's gut parasites. We're talking about worms, roundworms, tapeworms, the whole creepy crawly gang, and protozoa like Giardia. These unwelcome guests can set up camp in your cat's intestines, causing all sorts of digestive mayhem, including diarrhea. Think of it like this. You wouldn't want a bunch of strangers crashing at your place, eating your food and making a mess, right? That's essentially what parasites do in your cat's gut. They're stealing nutrients, irritating the lining of the intestines, and generally making life uncomfortable for your poor kitty. So, how do these freeloaders get into your cat's system in the first place? Well, they're sneaky little devils. They can hitch a ride on contaminated water, soil, or even other infected animals. If your cat is a hunter or spends time outdoors, their risk of picking up parasites increases. But even indoor cats aren't entirely safe. Those microscopic parasite eggs can cling to your shoes, clothing, or even other pets and make their way into your home. The good news is that parasitic infections are treatable. The first step is to visit your vet for a fecal exam. A fecal exam will help your vet identify the specific type of parasite causing the problem. Once the culprit is unmasked, your vet will prescribe the appropriate medication, usually in the form of dewormers or antiparasitic drugs. Prevention is always better than cure, so talk to your vet about a regular deworming schedule for your cat, especially if they're outdoor adventurers. And remember, good hygiene is key. Chapter 3. Stress and Anxiety. When your cat's gut feels the pressure. We humans know all too well that stress can wreak havoc on our stomachs. Those butterflies in your stomach before a big presentation? That's your gut reacting to stress. And believe it or not, our feline friends aren't immune to this mind-gut connection either. Cats are creatures of habit, and any disruption to their routine can send their stress levels soaring. Moving to a new house, introducing a new pet, or even something as simple as rearranging the furniture can throw their sensitive systems off balance. Imagine being plucked from your comfortable home and thrust into a completely new environment. Stress triggers the release of hormones like cortisol, which can affect gut motility and increase inflammation in the digestive tract. So how can you tell if your cat's diarrhea is stress-related? Look for other signs of anxiety, such as hiding, excessive grooming, changes in appetite, or aggression. The key to managing stress-related diarrhea is to create a calm and predictable environment for your cat. Provide them with plenty of safe spaces where they can retreat and de-stress, such as cozy cat beds, scratching posts, or even cardboard boxes. Cats love those. Establishing a consistent routine can also work wonders. Cats thrive on predictability, so try to feed them, play with them, and clean their litter box at roughly the same time each day. This helps create a sense of stability and reduces anxiety. And don't underestimate the power of TLC. Spending quality time with your cat can help reduce their stress levels and strengthen your bond. Chapter 4. Infections and viruses, battling the invisible enemies. Just like us, cats can fall victim to infections and viruses that wreak havoc on their systems, including their delicate digestive tracts. We're talking about bacterial baddies like Salmonella and viral villains like feline infectious peritonitis, or FIP. These microscopic mischief makers can cause a whole host of problems, with diarrhea often being a telltale sign. Imagine a tiny army of bacteria or viruses invading your cat's body, multiplying rapidly, and disrupting the delicate balance of their gut flora. Bacterial infections like Salmonella are often spread through contaminated food or water. Think of those raw chicken warnings you see on poultry packaging. The same principle applies to our feline friends. Viral infections, on the other hand, are often spread through contact with infected animals or their bodily fluids. Cats that roam outdoors are more likely to encounter these viruses, but indoor cats aren't entirely immune. So, how can you tell if your cat's diarrhea is caused by an infection or virus? Well, diarrhea is often just one piece of the puzzle. Look out for other symptoms like fever, lethargy, loss of appetite, vomiting, or dehydration. If your cat is displaying any of these red flags, it's crucial to seek veterinary care immediately. Your vet will likely recommend diagnostic tests, such as blood work or fecal analysis, to pinpoint the culprit behind your cat's symptoms. Once the infection or virus is identified, your vet can prescribe the appropriate treatment, which may include antibiotics for bacterial infections or antiviral medications for viral infections. Remember, early detection and treatment are crucial when it comes to infections and viruses. Chapter 5. Chronic diseases and disorders, long-term challenges, effective management. Sometimes diarrhea can be a frustratingly persistent problem, a recurring theme in your cat's life. In these cases, it's essential to consider the possibility of chronic diseases or disorders that require ongoing management. We're talking about conditions like inflammatory bowel disease or IBD and hyperthyroidism, which can significantly impact your cat's digestive health and overall well-being. Imagine your cat's digestive system as a delicate ecosystem, a finely tuned orchestra of organs working in harmony. Chronic diseases like IBD are like a rogue conductor, disrupting the rhythm and throwing the entire system off-key. IBD, or inflammatory bowel disease, is a chronic condition that causes inflammation in the digestive tract, leading to symptoms like diarrhea, vomiting, weight loss, and lethargy. Hyperthyroidism, on the other hand, is a hormonal disorder that occurs when the thyroid gland produces too much thyroid hormone. While it might seem unrelated to digestion, hyperthyroidism can actually rev up your cat's metabolism, leading to increased appetite, weight loss, and you guessed it, diarrhea. Diagnosing these chronic conditions often requires a multi-pronged approach, involving a combination of blood tests, urinalysis, imaging scans, and even biopsies in some cases. The good news is that while these conditions require lifelong management, there are effective treatments available to help your cat live a happy and fulfilling life. Medications, specialized diets, and even alternative therapies like acupuncture can play a role in managing symptoms and improving your cat's quality of life. Remember, if your cat's diarrhea persists for more than 48 hours or recurs frequently, it's crucial to consult your veterinarian. With the right diagnosis, treatment plan, and a whole lot of love, you can help your feline friend thrive, even with these long-term challenges. And there you have it, folks, a comprehensive look at the common causes of cat diarrhea and how to handle them effectively. We've covered everything from dietary mishaps to those pesky parasites, from stress-induced tummy troubles to infections and chronic conditions. Remember, knowledge is power when it comes to your cat's health. By understanding the common causes of diarrhea, you're better equipped to identify potential problems and seek timely veterinary care. Whether it's food sensitivities, parasites, stress, infections, or chronic diseases, knowing the root cause is the first step toward treatment. Remember to monitor your cat's symptoms closely and seek veterinary care if diarrhea persists or worsens. If you found this video helpful, be sure to hit that like button and subscribe for more pet care content. Let us know in the comments if you've had any experience dealing with cat diarrhea and what worked for you. Thanks for watching, and we'll see you in the next video. Stay healthy, stay happy.